when we invented rabbit technique, we are performing this surgery for thyroid nodules less than 4 centimeters in size. But with experience, we are performing the same surgery for nodules larger than 10 to 15 centimeters in size, like that of Mr. Deepak Rao.
It all started around February, March of 2022 when I started experiencing extreme fatigue, muscular weakness, extreme perspiration, hypermetabolic activity, and heart palpitation. When I consulted the doctor, they said it is classic symptoms of hyperthyroidism. I had also lost about 30 to 40 pounds in a short period of 2 to 3 months. So they got me started with the standard medications, which kind of helped me stabilize with all my symptoms. And sometime late October, I had a serious bout of cough when I was asked to go for an X-ray when they suspected maybe like a pneumonia or something. But then, what came out of the X-ray showed a deviated trachea and foot pipe as well. While I was consulting my endocrinologist in the US, after the X-ray results came out, they did not order for any further investigation. So I was a little surprised that though there was a deviated trachea and I personally felt additional work needs to be done, nothing was ordered out there. And I happened to make a travel to Bangalore and I consulted another endocrinologist here who immediately asked me to get a CT scan of neck and thorax done right away. The CT scan came back with a goiter that was substernal behind the sternum, and it was a fairly big sized goiter which was hitherto unidentified. Local endocrinologist in Bangalore gave me a few options, of which surgery was something that I may not be able to avoid, is what he said. And he had asked me to immediately see the surgeons with whom I can get the surgery done. So I saw pretty much all the top surgeons in Bangalore. All of them were told me that I had the operation involved sternotomy because this was a substernal goiter, and that was something that was appalling to me, and I did not really want to get a sternotomy done to take out the goiter.
Swellings of thyroid are also called goiters. Swellings of the thyroid gland can be noticed by you as a swelling in front of the neck or on a scan which is done routinely. Goiter need to be surgically removed when there is cancer in it or when it is causing pressure on the adjacent organ. 10 to 15% of goiters can have what is called as retrosternal or substernal extension, which means these goiters are extending into the chest, causing compression of the organs in the chest.
After almost a year of search, I still could not get convinced to go for a conventional surgery. Despite my best efforts to find a robotic method in the US, I could not get a convincing answer from the surgeons there that they could do a robotic based surgery and avoid conventional surgery. So given that, I decided to come back to India and search for possibilities here. After seeing one of the videos that Dr. Sandeep Naik has put out online of a live demonstration of the rabbit technique which he used for thyroidectomy, was something that truly convinced me to seek my surgery with him and using the same technique, because something that I wanted to avoid was a scar on my neck. So we said, why don't we give a try, and we came and met with him.
In Mr. Deepak Rao's case, he had a very large goiter with a significant extension into the chest. His goiter was about 15 centimeters in size and about 12 centimeters of it was inside his chest. These are very challenging cases to manage because these cases require surgery, and the surgery either involves an open surgery wherein we have to put a big wound in the neck, and extend it onto the chest, or we have to do it robotically.
Looking at the CT scan, CD, and other particulars, he came back to me with the proposal of surgery using the rabbit technique. There would be no, cuts on my neck like in a conventional surgery.
When Mr. Deepak Rao came to me, his biggest concern was he didn't want to undergo a open surgery with the sternotomy. So we suggested robotic surgery, which is a combination of rabbit and rat's technique. The rabbit technique involves a few small wounds below the collarbone, which accesses the thyroid gland with a robotic precision to remove it. Similarly, rats involves 3 to 4 small wounds to access the chest and free up the thyroid gland which is inside the chest. So the advantages of these two techniques is the robotic precision, the magnification that it provides with the least amount of complications.
And I'm truly happy that we got the surgery done with him on the 20th of October. It's been about 2 months since my surgery and I'm feeling absolutely normal and looking forward to getting back to work and getting back to my routine. I would dedicate all of this to Dr. Sandeep Naik and his team of experts who using robotic surgery and rabbit technique has truly helped me have a scarless surgery, and that truly has made me feel very comfortable and confident to get back to my normal life. Thank you so much, doctor.